Education Minister Jean-François Roberge and the Public Health Director Horacio Arruda. First of all, those who are wondering what this mask is, it's to encourage the impact tomorrow, to cheer them on. The series is starting tomorrow against New England, so we're wishing them good luck. Hello, everybody. Today, I want to propose to Quebecers a moral contract for the holiday season. What we're proposing is to allow gatherings, family gatherings, during 4 days. You don't have to gather all 4 days, but there are 4 days that where you'd be allowed. The 24th, 25th, 26th, and 27th of December. In exchange for this, so it's a contract. There are two sides to a contract. What we're asking Quebecers is to try to not have any contacts 1 week before Christmas and 1 week after Christmas. Why? Well, in order to avoid to transmit the virus. So we would like, during gatherings, we would like people to have been confined for a week before the gathering and for 1 week after the gathering. In order to do so, the first thing is I need the collaboration of employers. So all employers who are able to have their employees work from home, and that includes the government of Quebec, well, we have to telework. Secondly, for the businesses where it's possible to reduce the activities 1 week before and 1 week after Christmas, that would be ideal. We are asking for this, of course. We can't require it. For the schools, what we are proposing is that there be remote teaching. If we look at before Christmas, there are some schools who already were closed on the 21st or 22nd of December, but there are some that were open. In most schools were supposed to be open the 17th and the 18th of December as well. So what we're asking, Thursday the 17th, Friday the 18th, and Monday the 21st, Tuesday the 22nd, we are asking that there be remote teaching. That means that the teachers will work. They will speak at least once a day with their students, even in elementary school, and there will be some work that will be given. So we're talking about 2 to 4 days, depending on the schools in the regions. And after Christmas, these schools were supposed, the primary schools, let's start with the primary schools, most of them were supposed to open the 5th or the 6th or 7th of January, so there would be no change for the primary school, so they would reopen on the 5th or the 6th of January, so it would be clear. Now for high school, you have to understand that in high school, it's a bit less difficult to do remote teaching. So we would extend the vacation until the 11th of January. That's how it would be throughout Quebec, because throughout Quebec, we want that during the 4 days around Christmas time that families can gather. And ideally, we want to have a type of confinement 1 week before and 1 week after Christmas. I'm insisting to say that it's not vacation. There will be work given to the students, and there will be contact by video conference or on the phone with the children. What's also important to add, in Quebec, we've got specialized schools who provide services to children who need specific services. These schools will remain open throughout the period that was initially scheduled. Now, when it comes to childcare services, it's going to be the same thing as elementary schools. The only childcare services that will be provided will be for essential services. So the parents, the adults who provide essential services, for example, people in health, teachers, people from childcare services. So if we rely on what happened in the spring, well, there were very few children in the childcare services during the period of the 17th, 18th, 21st, and 22nd of December. I'm going to come back to gatherings from the 24th to the 27th. Firstly, it's important to mention that if somebody has any symptoms, any COVID symptoms, they cannot go to these gatherings. It's important to self-isolate when we have symptoms. We don't want to go contaminate others and then feel guilty that we've contaminated, amongst others, our elderly, people who are more vulnerable. So we must be careful. We must do all that we can to protect them. And even if we have had a week of confinement before the gathering, well, it's important to have good hand hygiene during the gathering, and it's important to stay at 2 meters away, especially from vulnerable people. What I also want to say, and I've talked to several people, not my mother, but others, it's possible that there will be some parents or some grandparents who are afraid, who think that it's too risky, and who would prefer to cancel these gatherings. Everybody in Quebec must respect these wishes. If there are parents or grandparents who say, you know, I'd rather not have a gathering this year, we absolutely must respect these wishes. We're protecting them, so we're not going to go against their will. So what I propose is a moral contract. On the one hand, there will be some gatherings, maximum 10 people, the 24th to the 27th of December. But on the other hand, we are asking that you do all that you can so that for the week before Christmas and after, people do not come into contact with other people. I understand that there are some people who will say, well, what do we do for New Year's? We are listening to public health. And I think that since the beginning of the pandemic, we have listened to public health, so we are still listening to public health. Obviously, if we allowed gatherings on the 1st of January, well then, it would create additional problems for the following week. And that is why we are saying that there cannot be any gatherings around New Year's. I understand that it's not necessarily easy. I'm thinking about parents who have children 1 week out of 2. Perhaps one will have to have the children on the 24th and 25th, and the other will have the children on the 26th and 27th. But I'm confident that given the severity of the situation, that we will succeed in finding compromises. Office parties obviously are prohibited, and everything that I'm proposing to you this evening is subject to the situation staying stable until the 24th of December. And that means, concretely, that all efforts that we can deploy as of today in order to limit contacts, well, that will increase our chances that we will be able to have gatherings around Christmas time. So it's important to mention this. There's an if in what we're proposing. I talked about families, but I know that for many people, there are some people who don't have family anymore, they have friends, and you can see your friends during these 4 days. Now, for the other measures, the measures that we put in place at the beginning of October, for restaurants, showrooms, gyms, the situation, listen, there are too many cases, and there is too much pressure on the health system. So unfortunately, I am announcing that these places will stay closed until the 11th of January. And we hope that as of the 11th of January, we'll be able to open them if there is a decrease in the number of cases by January 11th. So I understand that it's not easy. I'm thinking about restaurants. All of the assistance measures that we had announced will be extended until the 11th of January, and we hope that the situation will improve. But when we look at the situation throughout the world, well, we can say two things. First, there are some places where it's very worrisome, and secondly, these measures, restaurants, gyms, showrooms, these are measures that are in place just about everywhere in the world. I understand that it's not a big consolation. I also want to tell you that we're working very hard on the vaccination campaign. I said last week that even if the war is not over, we can see a light at the end of the tunnel. So as soon as the vaccines are available, we will be ready to vaccinate in all regions of Quebec according to an order of priorities. So in closing, I would tell you, I'm proposing today a moral contract for the holiday season. There is a risk associated with this contract. Seeing each other for 4 days, or 1 day, 2 days, 3 days, 4 days, has some risks. However, we must remember that family is at the heart of who we are. It's at the heart of our nation. Well, for me, anyways, it's part of my life. I've got the opportunity to have a wife and 2 sons, and I want to see them. I'm lucky enough to have my mother, who's 91 years old. I don't know how many Christmases we have left with her, but her and my 2 sisters, I want to see them. I need to see my family. And we also have to understand that now we're in a fight that has lasted a long time, since March, and unfortunately it will continue for a few months, so we have to recharge our batteries, and a good way to do this is to gather with our family. I think that the holidays, Christmas, is a time of year that is precious, and let's remember that family is at the foundation of our lives. So I thank you, everybody.
Good evening, everyone. Today, I want to propose a moral contract for holiday season. We propose to allow gatherings during 4 days from December 24 to 27 with a maximum of 10 people. But we ask people to limit their contacts as much as possible a week before and a week after. That way, when we'll see our friends and family, we'll limit the risk of contagion. To help us with that, I ask every employers to help their employees work from home as much as possible during that time. We'll also close the schools on December 17, but students will continue to receive their education online. That's only 2 to 4 days of online teaching for primary schools. And in primary schools, the calendar will start back on January 5, 6, or 7, depending on the region, as it was planned since a long time. In secondary schools, online teaching will continue until January 11. Special schools will stay open. We'll also keep daycares open, but only for essential services workers. Now, regarding our 4 days period to see our families, if we have symptoms, we need to isolate ourselves, even though it's Christmas. In doubt, it's better to be careful and avoid a risk to the life of our family. It's also important to protect each other by following basic public health rules as much as possible during the gatherings. And if we visit our parents, we have to be careful. Those rules also require that we keep the situation stable until Christmas. We must continue our efforts until then to have a great Christmas. And I'm also announcing that the restrictions in red zones will continue until January 11, and the financial help programs for closed businesses will also continue until then. So we'll need strength to get through this pandemic, and to find this strength, we need our families. Holiday season is a very precious moment with them, and family is the basis of our lives. So thank you.
Merci, Monsieur Legault. Donc, on va débuter la période de questions. On va prendre une question, une sous-question par journaliste. On va débuter avec...
We'll start the question period.
Bonsoir, messieurs.
Hello.
Vous avez dit, Monsieur le Premier Ministre,
You said, Mr. Premier, that there's an if in what you're proposing. Can we define what that if is? What is the maximum number of cases or deaths or hospitalizations that we can tolerate before we change our minds? If you'll allow me, in fact, there is no precise number. Obviously, the number of cases, if they keep increasing, they will generate more hospitalizations and more hospitalizations. So we'll have more difficulty controlling outbreaks. So we'll go into a cycle where there's a significant increase, and then we'll have to evaluate the hospital's capacity. Because quickly, even if we've got beds and equipment, we need staff. And if there's an increase in cases, we can have some staff that are sick. So I would say, obviously, there are some thresholds. We really want to stay below what we are at currently, because in certain regions already, it's putting pressure on the healthcare system. So it's an analysis that we do. And I want to tell you once again that it's important what we're telling you. We're giving you hope so that you can have a Christmas with your family members and safely, but it's very clear that it's conditional to the efforts that we will deploy before Christmas in order to stabilize and flatten the curve. Each one of the contacts that you will have is major, and it's not because we give the permission, the 4-day permission, that we absolutely have to party for the 4 days. The more contacts we have, the more we are at risk. We have to adapt this. We have to adapt our Christmas. And we can't let our guard down. Even during Christmas parties, we'll give you indications as to how to do things. We have to respect social distancing and wear a mask and wash our hands as much as possible. So I'm repeating this. You can see what's happening around us in Quebec. We are in a situation that is stable currently. It's fragile but stable. But if we want to get to Christmas and have these family moments with our family members, I want to hammer down this message. We must absolutely respect the measures that are in place. And with the measures that we have, we're taking a risk, because any gathering, and Dr. Fauci said this as well, any gathering, any family gathering contributes to increasing the cases. But we understand that we cannot prevent people from seeing each other, but the contract, the moral contract, as the Premier said, it's a major contract, and we will follow the situation day to day, and we hope that we will be able to maintain the number of cases at the level that they're at. I'd like to know if there's a possibility that the decision or the contract that's being offered today will change according to the regions. We can see that in the Saguenay-Lac-Saint-Jean, it's exponential today, the increase in cases. Would there be some regions who would have their gatherings prohibited and others not? As I said in a previous meeting, we want to keep it simple. And secondly, regardless of the region where we are, what we want is for people to protect themselves, avoid contacts 1 week before and 1 week after, regardless of the color of the region. If you'll allow me, Mr. Premier, there's still a month before Christmas. And we've seen in other regions that within a month, we were able to reverse the trend. So I'm inviting people in the Saguenay-Lac-Saint-Jean to do so that they can have a nice family Christmas. Question? My question is for Dr. Arruda. Dr. Arruda, you've already said that you expected an increase in cases after the holidays, and now we are hearing that gyms, theaters could start up their activities as of the 11th of January. Is that not giving them false hope to talk about this reopening for this date? If you'll allow me again, I think that, listen, the analysis that we did for the holiday season, we've been looking for 2 months at every possibility, every scenario, and we don't know where we will be in 2 weeks or at Christmas time. However, what we are telling ourselves, I think that we're trying to give perspective to people. We're giving a perspective so that people can get organized for the holiday season as of now. It's always conditional to the fact that we will have to control the number of cases. We accept, as the Premier said, a risk, a controlled risk, if you'll allow me, versus a necessity and to offer our elderly a Christmas. You know, we have to protect them. We can't isolate our elderly, and we also have to respect their choices. So what I'm telling you is that if we decrease the number of cases, if we decrease hospitalizations, the confinement period before Christmas and after, and not having a party at New Year's Eve, will probably help us to get to January in a state where perhaps we can even come back to where we are, but that would allow us probably to reopen with very specific conditions. So I think that we have to give ourselves that hope. Follow-up question. You're talking about gatherings, a maximum of 10 people during the holiday season. There are 4 days. There's all sorts of reasons to gather over the holidays. Must it always be the same 10 people who gather? Or is there an idea of bubbles that's still present? During the holidays, we wanted to make it simple. Obviously, the fewer gatherings we have over those 4 days, the better it is. It's not because we're allowing it that you necessarily have to party for the 4 days. We know that the number of 10 is a number that's recognized elsewhere as well. It's a number. And we had talked about 3 families, 2 families, bubbles, no bubbles, and we wanted to make this simple in order to be flexible according to the realities of different people. So at some point, it can be different people. If you have 2 gatherings, it can be 10 people, 10 different people. Ideally, it's always better to have people who live together to avoid, to increase the probability of contagion. But I think that if we are realistic, we're being flexible. It can be adapted to the reality of certain families, of people who don't live together and who have shared custody, single people who want to see their friends. But the principle is that it's allowed during those 4 days. You don't have to do the maximum that you can, but we're leaving you some latitude. You can't go above 10. That's how it must be between the 24th and the 27th. Hello, my question is for Mr. Roberge. So we're going to virtual teaching. The question we're asking ourselves, what do we do with the children who don't have a tablet, who don't have the internet, and who are already have been impacted since the beginning of this pandemic? Well, you are right to talk about teaching. We're not talking about of extending the vacation period. We're converting some days, which will become virtual learning days. For the young people in high school, there's no problem. We've got enough tablets and computers in the network to meet all the needs throughout Quebec for students who don't have that kind of equipment at home. And that's clear. We don't have enough for all of the children in all the primary schools, but we also have to say that for the younger kids, anyways, their autonomy to really manipulate, use a computer or tablet, well, it's not necessarily 100%, and they don't have the same attention span. And to say that, okay, I'm going to sit in front of a computer for several hours. So we've got a solution that is adapted to the reality of people in high school. We can do it. In primary school, there will be a daily follow-up. The teachers agree with us. I spoke with the unions, and they told us, well, we don't have any days off. We want to make sure that we follow up with our students. We can have a contact with them every day. And we're talking about 2 to 4 days only here, right? In December for the primary schools, it's 2 to a maximum of 4 days, because in January they go back to school. Follow-up question. I'm thinking about the people in the Saguenay-Lac-Saint-Jean where the rate of positivity today was double the rate in Montreal. Why are there only 2 days in the regions where it's really red instead of 4 days? I think for the Saguenay-Lac-Saint-Jean, before I let Dr. Arruda speak, I think that in the Saguenay, we have to give them a few days to stabilize the situation, because it was very, very difficult. And as you know, when we look at the number of cases, we have to look at a 7-day moving average, because there were some problems with some equipment, and the tests couldn't be done. There were some delays in the labs. It wasn't easy. So I would wait a few days, because I have the impression that we will see, with all the help that was provided to them, we talk with them, we're supporting them, particularly for the contact tracing, because that's what's important, as you know. So I think that for the Saguenay, given that everything that's happening right now, I prefer to wait a few days, and we will keep you informed. But I think that things will stabilize, in my opinion. Question. So you're allowing gatherings with parents and grandparents and people who are perhaps elderly, so they would be put at risk. What is your advice for people over 60 years of age, for example? Well, we're not forcing anybody to gather. As the Premier said, if somebody is anxious, if they're worried, we must respect their wishes. And we will supply, over the next few weeks, we will supply to all Quebecers some measures, some advice to help them gather as safely as possible. I'll give you an example. Grandma doesn't necessarily have to hold the baby or young children for 3 hours or for 8 hours. She can participate in the party. We can try to maintain a distance with elderly people. Obviously, the confinement before Christmas will help. If somebody's got symptoms, if you've got symptoms, you stay home. You go get screened, and you don't go see Grandma. You will see her when you're feeling better. I think that's very important. So we want to protect our elderly, but we don't want to isolate them. I think that's important. So they can come to the house, they will sit down somewhere, we'll keep a certain distance in the living room. If ever there's a contact, it's a contact that should be very short. We can wear a mask, and that will help. And not stay more than 15 minutes close to the grandparents, but they'll be able to be there, share the meal with us, etc. I wanted to know, perhaps Mr. Dubé, what is the capacity, the screening capacity, and at what point can you increase it during the holidays to make sure that people who need to be tested can get tested? Just today, this afternoon, I was talking with the CEOs of all the CIS and CISs, because we have to plan for this in advance. The minute that we made this decision, we were conscious of the fact that there will be some people in the days that will follow Christmas that will want to be tested. There will probably be an increase in testing. We're able to do the test because we know that we've done more than 35,000 in a day. So the issue when it comes to screening will be solved. and we'll have the staff to do this screening. But I would tell you, look at the progression that we've had. I was talking this week to the office of Mrs. Drouin. We are more than 200 people in Montreal only who are doing contact tracing. We've increased our capacity, our contact tracing capacity in all of our regions. We've got more than 2,200 people, and I think it's even a little bit higher than that. I'll give you an update. So we'll have all the staff necessary for screening and contact tracing. And the good news as well that I'm announcing today is that we just put online the famous platform that we've been talking about for a long time. So the platform where the questionnaire will be on the website live, so that it'll be even easier to screen and to do contact tracing. So we are truly ready for this period of time. It's just a matter of setting a date, which was very easy to do, by the way. And now that the date has been set, well, our staff is getting ready in order to be ready.
Bonjour, avocate.
Question
peut-être encore pour commencer pour Monsieur Roberge.
For Mr. Roberge.
C'est concernant les examens du
Concerning the ministry exams for the end of the year for secondaries 1 through 5, knowing that the report cards for January and June are 50% each, and that the rate of failure will be much higher than previous years, according to several teachers with whom we've talked. When will you announce how to compile grades for this year, knowing that the rate of failure might be historical? Will you lighten up the subjects or lighten up the value of the report cards? That's an interesting question. Firstly, we've made several adjustments since the beginning of the year. We are in direct contact with schools, with teachers, with the professionals who help students who are in difficulty. Just today, we were talking with our committee of experts, so we've done several changes, and we can still adjust, but I would tell you that we've already done a lot. We went from 3 report cards to 2, and that's positive because there's a bit less time spent on evaluations and a bit more time spent teaching, and that decreases the stress or the anguish of getting a first report card, whereas at the beginning of the year there was a lot of catching up to do. By having the report card at the end of January, well, the anxiety levels are going down a little bit. We're catching up before we see new subjects. And we've weighed the report cards the way that it used to be done. The last report card had a lot of importance, so the young people thought that everything was decided over a few weeks, and we've weighed this a bit. Now, for the ministry exams as well, there's not some every year, by the way. It's 4th grade, 6th grade, and secondary 2, 4, and 5. For the ministry exams, we have also weighed. We need to measure, right? Because there's a lot of people who say, well, there's going to be some failures. And I think that we have put a lot of things in place. We've hired professionals. We've decentralized the decision-making process. The schools are being managed differently, and that's going to have an impact on the success of students. And when we have the ministry exams, and we've decreased their value on the final grade, well, then we'll be able to measure the success of our students. But we have to give ourselves some time. I think that we're going to have wonderful success stories because our teachers in Quebec are able to adapt to the needs of students and to give a bit more help to those who need more help. Thank you. Follow-up question, Mr. Legault. At the beginning of October, Minister Fitzgibbon announced help for restaurant owners up to $15,000 for different things. 50 days later, many restaurant owners have denounced the fact that they haven't received this money yet. When will you pay these sums to the restaurant owners? Listen, I don't have a specific date, but I know that Pierre Fitzgibbon is very aware of the fact that there are delays in certain places, in certain regions, for the smaller restaurants. So he's working very hard so that this money can be sent as quickly as possible, but I think it should be in the next few weeks. Thank you. Question, Mr. Legault. You told us on Tuesday that there could be some small changes in the measures for youth activities. Do you have any details to this effect? We're in discussions with public health. I would like to allow young people to do sports, Obviously,
dans les arénas, c'est à
in the
l'intérieur,
arenas, it's
même s'il y a
indoors,
beaucoup
even if there's a lot of
d'espace,
space.
il y a les ronds à
There
patiner extérieurs,
are the
je me rappelle
exterior
des beaux
rinks.
souvenirs.
That
Donc, on
reminds me of
continue
a
les
good
discussions.
souvenir. So we're in
Ça
discussions.
va bien, les discussions?
And how are the discussions going? They're going well?
Ça va bien aller.
Ça va bien.
It's going to be okay. And for the gatherings during the holidays, can we go from region to region?
Pas souhaitable. C'est pas souhaitable.
Well, we discourage it. It is not recommended. You'll remember as well that when you come from a red region, you must apply in the region where you're going the same rules. However, we are conscious of the fact that in certain situations, it may occur, if ever it occurred, even if it's not recommended. You really have to apply the measures from the red zone. And let's say, a son wants to go see his mother in the lower St. Lawrence, perhaps. They want to go see them, but they don't realize that they've been contaminated, especially if he hasn't confined before the holidays. So you'll understand this is how the virus is transmitted from one region to the next. I don't want to get into the details. In the Saguenay, that's the type of thing that we saw. So I think that it's not recommended at all. If it must be done, if there are specific situations, we must be very, very careful. I'll give you an example. Let's say somebody from Montreal goes to Tremblant to their cottage on the weekend. Well, they have to bring their food for the weekend. They have to stay in their cottage, and they can't go to the restaurant. Question. So Quebecers who want to celebrate Christmas, so they must isolate 1 week before Christmas, but that week is the busiest week in shopping centers. Is that a risk that we must take as a society? To go see all sorts of people to buy our Christmas presents? Well, it's a question that I asked. One day, maybe I'll be a journalist, but yes, there is a risk, but the risk is not great. In stores, we're not seeing a lot of problems. In the slaughterhouses, there's problems, and in the schools, there are some outbreaks, but in stores, and if you'll allow me, I think that, first of all, we would like people to buy locally. We can do it online. We can do it in shopping centers. Shopping centers, we had some discussions with them. They will insist. Well, obviously, if you're at risk and you're afraid to go in a place where there's a lot of people, well, look for an alternative. However, shopping centers will make sure that they increase the hygiene measures. They will create corridors. They'll avoid the waiting lines where people are right next to each other. I think there's a way of doing things without transmission of the virus. But everybody must evaluate their own situation, their own risk, and perhaps go at a time where there is fewer people. We're recommending to people that they buy their presents as soon as possible so that they're not stuck at the last minute. Often, for work reasons, I wait until the last minute. But this year, try to shop early to avoid busy shopping centers. We've asked the collaboration of the owners of shopping centers so that they make sure that things are done in an adequate manner. It was the case at the beginning of the reopening. We didn't see people all stuck together at the entrance of a store. We're going to ask people to behave in the same way, to wear the mask, to wash their hands, and go shopping, but be careful, don't get too close to other people. And start your Christmas shopping early. The rebates are already starting. You said earlier, Mr. Dubé, that you will increase the capacity for screening during the holidays. Will you increase the capacity in terms of staffing as well? Up to what extent? Because I imagine that the 24th of December, some people will say, well, we're going to see Grandma in 2 days, we'll go get tested. So the 24th and the 25th, the 26th, will you have a lot of capacity, a lot of staff for people who are asymptomatic, who don't want to take any chances? Well, that's exactly what I said earlier, and I'll repeat myself because it's important. We will have the capacity to test that will be required. I talked about it this afternoon with the CEOs. Everybody was waiting to see how we would get organized in our dates, but I'll remind you of one thing. We don't get tested just to make sure that we don't have COVID. There are 3 criteria. The criteria are, were you in contact with somebody who tested positive? Do you have any symptoms? And were you called? Did contact tracing call you? We can't make sure that we're not symptomatic just by getting tested. So I think that the period of time that will be important, where we will have to make sure that we have enough staff and to have all the information that is required, or the staff required, is after the 24th. And that's what we were talking about this afternoon with our CEOs. We want to make sure that we have all of the resources in each one of our screening centers. And that is why we absolutely wanted our new platform to be live, so now we've got a month to test it. So in terms of capacity, we will be fine. I would like to say that it's dangerous to rely on a test, on a negative test, and to think that we can't contaminate somebody else. Because before the test becomes positive, it takes a certain amount of time, and sometimes you're already contagious. So people who think that by getting a test on the 23rd, or even on the 18th or 19th or 20th, and then they get a negative result, and then they go to a party, that is very dangerous. There are all sorts of people who have been tested, they thought, and they got negative tests, they didn't think they were contagious. The thing to do is what we have told you, is to do the confinement, as we've explained, and if you have any symptoms, you go get tested. But do not rely on a negative test. And I will tell you, that's a big mistake. What we need is to gather with the measures that we have stated. I would add, and I think most reporters who are here are aware of the fact that there will be a technical briefing tomorrow morning. I hope that I've got the right graphic here. I don't know if you can see from there, but there will be a technical briefing tomorrow morning for reporters with Dr. Arruda and with Dr. Lidwak, who you know, who had created the alert system. And this document will be available to you tomorrow, and it will be online. It really explains the steps of contagion. And we take the calendar, the same calendar, to explain that somebody who is positive, for example, as of the 16th, when are they contagious, when can they transmit the illness, etc. And it's very well explained here. And we've got the important period here from the 24th to the 27th. So I would invite people, and that is why we didn't go into the details of all of this evening, but your question is very apropos. This is what concerns us here, and that is why we decided to leave that period of time. The reporters tomorrow can ask all the questions they want. They can ask Dr. Lidwak, because he's really the one with Dr. Arruda who built the protection system. So that will be available for you tomorrow morning. So you don't advise people who just, as a precautionary measure, would want to get screened before Christmas, before meeting Grandma? I would tell you the answer is no. Because it's not because you've been tested 24 hours ago that 6 hours later, for whatever reason, you can't transmit the illness to somebody else. That's the problem. That's why we have to make sure that if we feel okay, we don't have any symptoms, we weren't in contact with somebody who was positive, we didn't receive a phone call from public health, respect the confinement measures, respect the hygiene measures. And if you think that during those 4 days you've got these problems, you've got symptoms or whatever, go get tested as quickly as possible. If I understand, on New Year's Day, it's Quebecers in their own bubble. We watch Bye-Bye on TV. And we send our good wishes from home. And we try to forget 2020. Yes. That was my only question. Thank you. We'll go to the English questions.
Hi, good afternoon. If you could just repeat what you just said about the bye-bye.
About what?
About what we should do for Christmas, the New Year. You said that we should watch. Can you say it again?
Bye-bye. I know it's in French, but yes, it's important. And we had many discussions in the last few weeks with public health authorities, and it's clear that we have to concentrate the gatherings within 4 days and make sure that the people, I come back to about being tested. The best thing that you can do is the week before you meet your family, you don't meet anybody else. And if you don't have any symptoms on the 25th, you should be all right.
Okay, well, I'll go with my actual questions now. Why are we allowing meetings of up to 250 people, but not allowing cinemas or concert halls to open?
Okay, it's clear that we don't allow 250 people meetings. Maybe the way that the document was written was not fine, so I don't exclude the possibility of being more clear. But there's no question, and I cannot imagine. I know that some people said, for example, that a vote for in a union may need to have more people in the same room. I think that you can do that with Zoom or Teams or whatsoever. So I don't see any exclusion where we would permit gatherings. So it was a kind of statement saying that if there's an urgency, maybe we can allow them, but I would prefer to say, no, it's not allowed.
Okay, and then the other one is, why did the government pull out of talks to help with loan guarantees for the new REM station at Trudeau Airport?
For the what?
Why did the government pull out of talks to help with loan guarantees for the new REM station at the Trudeau Airport?
Okay, but first, we think that the station in Trudeau Airport must be paid either by ADM, who's the owner, or the federal government, who was the preceding owner. But we think that, yes, we can bring the REM to the airport, but the station has to be paid either by ADM or by the federal government. But I will tell you, it's urgent that we have a station at the Trudeau Airport. It doesn't make sense that a big city like Montreal doesn't have a station at their main airport.
Can I ask you why, though, do you think that the federal government or ADM should be paying for the station?
Because they own the airport. So if we have a station at the airport, it has to be paid by the owner, the actual owner, ADM, or the preceding owner, which was the federal government.
Thank you.
We'll go with CTV.
Hello. I guess the first question is, this benefits a lot of people in this room, but Hanukkah falls from December 10th to 18th. It is one day a part of our voluntary confinement period. What are we saying to Quebecers that we also talk about having a secular state? What are we saying to Quebecers that say do not celebrate Christmas? This is the only window that they get to have where it's sanctioned to stay home. What are we telling Quebecers who are either not Christian or do not celebrate, have secular Christmas, I guess, Festivus, whatever you want to call it, but what are we telling them?
I think that right now we have a very critical situation. We think that we can permit gatherings during 4 days. So where do we put those 4 days? I know that some people, they prefer to celebrate the New Year than celebrating Christmas, but we've said we think in Quebec that most of the people would be happy with those 4 days. So that's the way we choose those 4 days.
My second question is, I guess maybe something for Mr. Dubé or potentially Dr. Arruda, or maybe you know, Mr. Premier. Other provinces have been talking about, and maybe this is good news because we're thinking about the vaccines coming. Other provinces, their health departments have talked about how many vaccines they're already expecting to have. Have you guys been getting indications about how many vaccines of either of the two candidates that you're expecting to get of these 4 and 2 million?
Yeah. I'll let Christian complete, but we have exactly the same information as Ontario have. So what Mrs. Elliott said yesterday, we thought that the federal government didn't want that we put that public, but we have exactly the same information that they have in Ontario.
Exactly, because That was supposed to be confidential information, but we have all the same information. We have the same timing. We're getting ready to get all the material that will be done in Q1, and depending how they want to deploy it, we'll be ready to take that.
But we won't say how many today.
Well, it depends on what will be available, but the numbers we have received are the same data that has been provided to Ontario. We're getting our pro rata, but the agreement was to keep it confidential. It has not been followed, but we will follow the rules.
And if I may add, we will get the quantity needed in Quebec in relation. We will not let another province or the feds don't give us what we are supposed to have.
Well, the first question would be for Mr. Dubé and Dr. Arruda. We're understanding here that these 4 meeting days, it doesn't have to be the same 10 people. It can be different groups of 10 people. Now, there is a possibility here that you're going to talk about people who are meeting 10 on the 24th, another 10 on the 25th, 26th, 27th, a possibility here of 40 people in this large bubble. What does that worry you? And what would you say to the people who are maybe thinking ahead and saying, I'm going to try to get all my, social contacts in this 4-day period?
Okay. I think you've answered that before, but I will let you repeat it. And in the meantime, I'll show my board.
Okay. We allow 4 days of 10%. But it doesn't mean that we do recommend it. If you can do all that in one meeting, that's better. Every time you're going to have gatherings, the risk is getting higher, even for your own health. So, in fact, it doesn't mean, and we concentrate that on those 4 days because the impact of this on the society and if you have done that I would say at the first eve, that would have been a big problem because the ones who are get infected in Christmas will multiply again in I would say in the even. So I think that the best thing to say is that do your family or friends gatherings, let it do it at the minimum, enjoy that wonderful moment, okay? But don't try to say it's going to be a big party 4 days and we are in Carnival. That's not at all what we are looking for.
And the second question I have is for Premier Legault. Around the holiday period, we're talking about trying to self-isolate a week before and a week after. From a public security standpoint, there have been periods where we've done more checking in, more police operations, more crackdowns to make sure that people aren't gathering. Is there a plan to do more of this around the holidays to try to make this as smooth as possible?
We'll continue to make sure that the police, for example, on New Year, if you have 10 cars in the front of a home, I think we may knock at the door and see what's happening. So the police people will check for the rest of the holiday season. Yeah.
But is the idea to keep checking, but is there going to be a ramp up? Are we going to do more of this given that people are going to be gathering?
I think we are already doing a lot, but we'll continue to do so.
We'll go with Montréal Gazette.
Bonsoir.
Bonsoir.
Given that the incubation period of the disease is roughly 14 days, are you not concerned that even with a buffer of 7 days, that by allowing more gatherings than we have in months, and particularly for, say, young families who are thinking of getting together now with their parents or grandparents who might be in their 80s, that we're putting out too much risk for Quebecers at this point, and that could actually lead to tragedy following the holidays?
We will explain that tomorrow in the technical briefing, but I just want to tell you that the incubation period can go to a maximum of 14. Most of them is around 5 and 6 days. So we are, there is always a risk of something happens, but we are calculating exactly what are the means that are recognized, and you will understand when we're going to, our minister is going to show you. We have been looking at that exactly to make sure that those days from 17 to 24th, you would compare, if you get infected on the 16th, which is the last day before the confinement, the time you're going to be confined, symptoms are going to appear, and then we're going to be catching up you before your Christmas Eve. So I think that we have used what is the mean and where most of the infections are getting to be incubating.
And for people who don't celebrate the same time, for instance, Hanukkah, could there be provisions for them, say if they attempt to quarantine from December 3rd for the start of Hanukkah, December 10th, is that permissible, or you're saying no, just this period?
We say no.
And why?
Because we have to concentrate those meetings within the same 4 days because of what we propose regarding schools, for example, regarding work, what's happening in companies. So it's very important that we set 4 days and that a week before and the week after, as many people as possible in Quebec become fine.
We looked at all those scenarios, 2 days on one, 2 days on the other, 4 days on one, 3 days on one. If we get 4, it's to help families who cannot be on 2 days, parents who have kids that they share because they are separated. We look at this, but you can not understand the impact of having parties in Christmas and the same people in parties in Jour de l'An or Happy New Year. It's a terrible thing. It's going to augment the risk of transmission. We are taking that risk to be able to get a family or gathering of friends for a short period, not necessarily the 4 days, could be 1, 2, that's it, and minimizing the impact of this because there's going to be impacts even of Christmas. We think there's going to be cases of transmission between Christmas. It's normal.
Merci tout le monde, bonne soirée.
Merci tout le monde.
Merci.